South African scientists have told the government that at this stage, the C.1.2 coronavirus variant detected locally was not a threat. The C.1.2 variant was first identified in May and has now been seen in all of the country's 9 provinces. It contains some mutations associated in other variants with increased transmissibility and reduced sensitivity to neutralising antibodies. We're going to take this discussion further then. Let's bring in Dr. Adrian Puren, who's the Acting Executive Director of the National Institute for Communicable Diseases. Dr. Puren, it's always such a pleasure to see you. A very good afternoon to you, and thank you as always for availing yourself to us.
Thank you very much, and good afternoon, and to your viewers as well. Appreciate the opportunity to speak to you.
Dr. Puren, there's this question that's been all over social media the past couple of days, and I think the more experts actually weigh in on it, the better for us all. The question is whether or not the unvaccinated are the reason for emerging variants, or that they drive variants. What exactly is the answer to that? Can we have some sort of clarity?
Yeah, so I don't think it's a matter of just vaccinated or unvaccinated. That does play a role. But I think when we started off with this particular pandemic, we were all susceptible. And so as the virus moved from person to person and under certain circumstances, there would be mutations accumulating along the way. But now we have the opportunity to manage the spread of this particular virus, and that's by vaccination as well. Of course, we have the other non-pharmaceutical interventions, which are still very important and still critical for us. So I don't think it's a matter of trying to stigmatize people who are unvaccinated. I think that's really critical to move away from that. But it is critical to say that the non-pharmaceutical interventions, such as the wearing of masks, the physical distancing, are all parts of these attempts to manage this particular pandemic. So the more transmission or continued transmission there's the likelihood of the accumulation of mutations, and the effect of these mutations, as we've seen, for example, in our second surge and our third surge, is that these have been dominated by viruses that have accumulated mutations, a consequence of which is that they become highly transmissible, and in addition to that, they escape mutation. So the key here, of course, other than the non-pharmaceutical interventions, is the vaccine. So the more people we are able to vaccinate, the less transmission there should be that will occur, and the less likelihood that we should have additional or different variants arising that have these particular properties. But again, you can have the exact opposite of that. But I think for the moment, the idea is really for us to try and control transmission and therefore control mutations arising and the variants that.
Doctor, how much do we know about this C.1.2 the variant at this time? Scientists are saying that it's not really much of a concern at this time. And on the back of that question, I'd like to ask: is that based on the fact that many people have already had COVID-19 and then recovered, and some have, of course, a lot been vaccinated as well? Is that possibly the reason why scientists are saying that it's not that concerning at this time? Are we maybe making headway in terms of the vaccination? And of course, those who would have already had COVID-19, would they have had some sort of immunity?
Yeah, you raised the two important points. So these mutations are there, but we don't have the actual, laboratory evidence that these mutations are having a specific effect. So it's really important for the laboratory work to be completed. In other words, trying to look at whether or not with this constellation of mutations, again, because although we're focusing on 1 or 2 mutations, it's really that whole virus in and of itself that we need to determine whether or not there will be an increase in transmissibility and immune evasion. So the types of experiments that will be done are in the laboratory to grow this virus in cells and compare it to wild types and see what the rates of growth are of this particular virus. That's the one part. And the other, you're quite right, is people have been exposed, so looking at seroconvalescent serum, to a previous wild type or another mutant or another variant, and or people who have been vaccinated. What are their responses to this? So when we look at that constellation and we look at what's happened with other variants, the likelihood is that the vaccine will still be effective. And in particular, I think our focus is on severe disease and hospitalization. So I think our sense is that it should still work. It may not work to the same extent as it does against the wild type, but at least with regard to severity of disease and hospitalizations and death, the vaccine should still remain effective, despite that this is a new or different variant. Yes.
Yeah. It seems that the daily cases that are recorded are slowly decreasing, and I wonder when you look at that, I mean, is this how much of that can be attributed to the fact that at this point you have 13 million and counting South Africans that are being vaccinated at this time, or could it be, and this is wishful thinking on my part, that we're slowly getting rid of this virus? I mean, what is that? Where are we really? I mean, as I kind of sit here every day and I have to say these numbers to the public, and I kind of see where we are, and I'm seeing that, okay, we're decreasing here a little bit, and I'm just wondering, what is it attributed to really?
Yes, I think there are multiple things. You're quite right.
Yeah.
I think that in the main, we've had people that have been exposed to in terms of the second resurgence at least. So there's a certain degree of immunity that has occurred within particular populations. However, there are probably still fairly substantial individuals who have not been exposed to this virus, not exposed to the vaccine. So that means that we still have susceptible individuals. So even though you're quite right, we are slowly but surely moving out of this particular resurgence in the main. Yeah. There are still some provinces, because again, it's a fairly heterogeneous picture. I'm sure when you describe to your viewers, it's just not one picture. It's multiple pictures that you have to present in terms of the different provinces. It's in particular the Western Cape, Eastern Cape and KwaZulu-Natal. Those, at least now, their trajectory is downward. But when you look at the Free State and the Northern Cape, the trajectory is it's ongoing, and in fact is increasing, and hospitalizations and so forth are certainly in the main coming down. Deaths in the main are coming down. So yes, I think slowly but surely we're working our way out of this particular resurgence, but there's still a fair proportion of individuals that are vulnerable. Even though we've done I think it's 20% or 24% of our above 18-year-olds have been vaccinated. So I think there's certainly a contribution of the vaccine to what we've seen in this particular resurgence, but we still have to reach that high watermark. I know that we started off by saying and talking about so-called herd immunity. I think we're starting to change our terminology around that. So we still need a way to go, given that the current variant is highly transmissible, and that the so-called efficacies that have been reported for the vaccines are also varied in terms of, say, the Johnson & Johnson and the Pfizer.
Yeah. We had heard from the Department of Health confirming that we are likely to enter the fourth wave of infections in December. Now, when I'm hearing that this current variant isn't as harsh as we had anticipated, I'm hoping that in this case that, the Department of Health may indeed be wrong about this fourth wave in December. Also, due to my own thoughts, thinking, at this time we're out of winter, we're out of, the red zone, we're out of the danger zone. We had been told that the winter season is really the time when COVID deaths are at their peak. So one wonders if December, when we know in our country that's really where the heat is, if we really are going to be experiencing what the department is saying. Could they possibly be wrong?
Again, it's very difficult. It's really a complicated picture. I think what will be important is that we achieve really high rates of vaccination by December time. If you recall, December last year, 2020, is not that far off in a way. In terms of our memories. We did actually have a marked surgence as well. So I don't think whether there's certainly a contributing factor, but it's not the entire factor or explanation for what actually occurs. So I think we just need to be cautious. I think that the resurgence may well be different, especially if we achieve high rates of vaccination and immunity. And I think, let's hope it's not as marked as we did see, at least in the second and some parts of the third resurgence. Again, if you look at the data, I think it varies by province. So I think we just need to be cautious around that.
All right, Dr. Puren, it's always a pleasure. Thank you so very much. We appreciate your input here on SABC News, sir.
Thanks for the